Okay. The clavicle articulates with the sternum at the sternoclavicular joints. The clavicle here, sternal end, articulates with the sternum boom here look, this is the sternoclavicular joint. The clavicle articulates with the sternum at the sternoclavicular joint. Okay, and with the acromion of the scapula at the acromioclavicular joint. With the acromion of the scapula here, acromion of the scapula at the acromioclavicular joint. Sternoclavicular, acromioclavicular. Deal? The next one, the scapula is a bone with no direct connection to the axial skeleton. The scapula, here, the scapula, it has no direct connection with the axial skeleton. Okay? Now we have to just talk about the clavicle and the scapular parts. And this is really important for us to remember the pins, our pins. The clavicle is a flat S-shaped bone. The clavicle is a flat, here, it's a flat S-shaped bone, okay? It's S-shaped with anterior convexity medially. This is medial because it's closer to the body. Anterior convexity medially and posterior convexity laterally. So here convex, anterior convexity medially, posterior convexity laterally. Okay, you can of course then talk about the pins that we know. We have, it has sternal facet, it has costal tuberosity, okay, on this side, sorry, here, costal tuberosity on the posterior end, okay, here, costal tuberosity. We have the shaft, okay, the shaft. We have coronoid tubercle oblique line here. We have coronoid tubercle. Of course, you guys all know, you should all know your pins. Coronoid tuberosity for the attachment of the coronoid ligament, which is the second part of humerocoracoid, probably something like that. Don't remember. But this is an attachment of a ligament. Wait, let's just check it. How about that? Because I'm curious. There, see, coronoid tubercle. That's trapezoid. Wait. Yes, but yes. That's why it's called conoid tubercle. See? Because of this ligament. And you have this tubercle, boom, attachment of ligament. These two make up one ligament, the tubercle part, trapezoid part, and the conoid ligament. They are part of two ligaments. Wait. They are two parts of a ligament. 1 second. I forgot. Yes, exactly. Coracoclavicular ligament. Exactly. Coracoclavicular ligament is made up of two parts. Trapezoid ligament and conoid ligament. We don't need it now, but we just wanted to mention that the conoid tubercle is there because of the conoid part of the coracoclavicular ligament. Okay. And you have the acromial facet and acromial end. This is acromial end and acromial facet to articulate with the acromial process of scapula. I'm speaking like Serisky now. Okay. Clavicle, anterior medial convexity, posterior medial convexity, sternal end, S-shaped flat bone, conoid tubercle, acromial facet, acromial end. Boom, you're done. This is the clavicle. Now we have to speak about the pins of the scapula to describe it to you. Yes, scapula. We know that the glenoid cavity is on the lateral aspect of the scapula. Okay, the scapula is an irregular triangular bone, with two articulations, one with the clavicle at the acromioclavicular joint and one with the humerus at the glenohumeral joints. Acromioclavicular joint and glenohumeral joints. Of course, we can see the pins of the scapula. And I will share this with you here. Boom. Shared. Acromial process. Okay, we say is that this. Okay, guys, I have a question. Which one is this? Right or left? Wait.
This one is right.
This one is second. It's this one is left. This one is left. Why? Why is it left?
But
This
the
one,
acromion here is located posteriorly.
yes,
And
exactly.
it's supposed to be right.
This one is the left one. Why? Always the spines of the scapula are found posteriorly. Yes. Take this one out and put it on your right end. Is it correct? You have to switch it and put it on the left. That's what you should do. You get it? Right now, if I take it and put it on my right side, it won't work because I have to rotate it. Always the acromial process on the posterior end, right? My posterior, not the screen's posterior. So if I take it like this and I put it, the acromial here will be anteriorly. It's wrong. If I rotate it, it will fit. Okay, hint. This is always lateral, yes? This is always lateral, yes? What's the surface that you see here?
Posterior.
This one is posterior?
Or costal.
Yes, this is the costal surface. This is the costal surface. It's not the because
posterior
process
is the side of the spine, right?
Exactly. So you have the coracoid process, and the coracoid process is always on the side of the costal surface. So now it doesn't work that this is the right, this is the left, because you'd have to rotate it and get it on the costal surface on the posterior end. This has to touch the ribs posteriorly, always. You get it? No?
Yeah.
Okay. If it's hard, just practice that. But it doesn't matter. At the end of the day, it doesn't matter. Okay. So now, acromial process laterally. We're talking laterally. Acromial process, coracoid process, glenoid fossa. Then we have lateral border, medial border, and we have superior border. Then we have superior angle, inferior angle, and this angle, which is, we don't talk about it. That's it, superior and inferior angle. Okay, and then we have scapular notch and subscapular fossa. Subscapular fossa is the fossa that allows or touches the costal surfaces. So this is the costal surface, okay? This is the whole end, and this is how you should speak about it. Again, the pectoral gird, or the, what was it called? Yes, pectoral gird, shoulder gird. Yes, shoulder gird is also called as the pectoral gird. Its main function, its main function is to hold the upper limb, and connect it to the axial skeleton. The shoulder gird or the pectoral gird is made up of two separate bones. Number one, the bone clavicle, flat-shaped bone, S-shaped, flat S-shaped bone. It has a sternal end and an acromial end. The clavicle has anterior convexity medially, posterior convexity laterally. It has attachment to the sternoclavicular joint. It has attachment to the acromioclavicular joint, and it has a conoid tubercle for the attachment of the conoid ligament, part of the coracoclavicular ligament. The only attachment of the scapula to the clavicle is through its acromial process found posteriorly. Now, the spine of the scapula is found posteriorly. It extends to form the acromial most laterally. Superior, I think supraspinatus and infraspinatus fossas, these superior and posterior below the spine and above the spine. And then we have superior angle, inferior angle, medial border, lateral border, superior border, and this notch, subscapular notch. And that's it. That's all what we have to see. You're done. Any questions about this one?
Okay, so we have to mention joints of the shoulder girdle and also all the pins of scapula and clavicle.
Yes. So also remember, I didn't mention here, we have one joint, acromioclavicular, and the glenohumeral joint of which the scapula is involved with. Okay. But yes, that's it.
Should we
By the way,
Go ahead.
sorry.
Okay. Go ahead.
go ahead?
Okay, I have a question. Like, the glenohumeral joint really seems to be like a shoulder joint, isn't it? Like
Yes.
shoulder joint.
Yes.
It is a shoulder.
Yeah. It's a
Can
shoulder
you hear
joint.
me? It's the same, right?
Yes. Shoulder joint, glenohumeral joint. Yes.
And another question: should we first start with mention the pins, or like
No. So first we say, yeah. Go ahead.
start? Yeah, if we like the main function, and after it, like we go ahead with the pins. And if we list all the pins, she's probably going to stop us before we say the joints. So how do we do that?
So before you start mentioning pins, make sure you tell him the general stuff. Pins are so specific. Pins are the most specific thing in this thing. So now we have to say the function, function of this is to shoulder gird made up of two bones. Bam. Function. They attach the upper limb to the axial skeleton. Now, next point. We talk about them individually. Clavicle and scapula. Clavicle, we know everything as shaped, flat, convexities, sternal end, acromial end. Then we say that the clavicle is informed in part of two joints, sternoclavicular and acromioclavicular, and then you're done. And then you can talk about the connection between scapula and clavicular, which is coracoclavicular ligament, made up of conoid ligament and tubercular ligament, something like that. Okay. And then you talk about the scapula. Scapula is involved with two joints, acromioclavicular and glenohumeral. And then you can see that it's a flat bone, right?
Yes.
Yes, so flat bone, and then you can just mention all of the pins that you know. Anteriorly cricoid, posteriorly acromial. The acromial is an extension of the spine. Then glenoid cavity is the cavity used as an articular surface with the shoulder joint. Then you can mention all the pins, and then you're done.
Okay.
The clavicle is flat or long bone?
Clavicle is flat. This is a long bone. This is a flat bone.
Both scapula and clavicle are flat
Yes.
in this case.
Yes.
Okay.
One second. Yes. Yes, it's a flat bone. Perfect. All good. Okay. All good about this one?
Mm-hmm.
Done? Okay. Now we're done 4. We have one more. Which is number 5. Pelvic gird. I hate this one.
Everybody does. It's the worst.
Bro, I didn't like it, but I think I studied so much. I think it's okay now.
I skipped studying that for the last minute I studied it for pins and orals.
Yes, the pins for this one was annoying.
Yeah. Yes.
Okay, there. Ready?
Yes.
I'm sorry, this one is gonna hurt, but let's go. Okay. All right. Okay. It's a ring-like bony structure located in the lower part of the trunk. Ring-like bony structure located in the lower part of the trunk. Okay. It connects axial skeleton to lower limbs. Connects axial skeleton to lower limbs. Axial skeleton to lower limbs. Yeah. Okay. The next thing we're going to talk about, the bony pelvis consists of 2 hip bones. Again, the pelvis or the bony pelvis is made up of 2 hip bones. 1, 2. And I'm saying hip bones, all of this. The hip bone is all of this. And you have 2 of them. Okay? The bony pelvis is made up of 2 hip bones, the sacrum and the coccyx. 2 hip bones, here and here, sacrum and coccyx. Deal?
Are you showing right now something on your screen? Because I cannot see it.
Are you
Actually.
serious? Oh my God, no way.
Yes.
Okay, there we go. Here. Now?
Mm-hmm. Yeah.
Okay.
Yeah.
Man, I'm so sorry. Thank you for telling me. Okay. Oh my God, that was so stupid. Okay. Bam, bam, bam. Right. Now, the hip bone is made up of the pelvis is made up of 2 hip bones, sacrum and coccyx. Good? Easy?
Mm-hmm.
Okay, next. The structure of the pelvic gird. We're going to look at the structure of the pelvic gird. So the structure, we said 2 hip bones, sacrum and coccyx. And there are 4 articulations within the pelvis. 4 articulations within the pelvis. 4 articulations within the pelvis. Number one, two sacroiliac joints. Two sacroiliac joints here and here between sacrum and ala of ilium. Sacroiliac, two sacroiliac joints. Third, so we have 1, 2. Number 3, sacrococcygeal symphysis. Sacrococcygeal symphysis between sacrum and coccyx. And then finally, pubic symphysis. Pubic symphysis. Pubic symphysis. Here, you have a connective tissue called pubic symphysis. Okay? Sacroiliac, 1, 2, sacrococcygeal, and pubic symphysis. These are the 4 joints, and this is the structure of the pelvic girth. There are ligaments, of course. Ligaments, of course. But let's first discuss the functions of the pelvis. Functions of the pelvis: to transfer weight from upper axial skeleton to lower appendicular skeleton. It just transfers weight from upper to lower, okay? The second, it provides attachments for muscles. Provides attachments for muscles. And the third protects the abdominal viscera. There are organs here, such as, let's say, the intestines or the rectum. They lie here. Okay, they protect it. So this pelvis protects these things. 3 functions: transfer of weight, provides attachment for muscles, contains and protects the viscera or the organs. The next thing we have is the greater and the lesser pelvis. The greater and the lesser pelvis. The greater and the lesser pelvis. The greater and the lesser pelvis are just 2 regions. 2 regions. The greater pelvis is the false pelvis. The false pelvis, so the lesser pelvis is here, contained in this region. The greater is contained in this region. It's called false because you really don't have clear borders, but lesser, it has very clear borders. Okay? The greater pelvis, located superiorly. Located superiorly. It provides support of the lower abdominal viscera. Provides support of the lower abdominal viscera. It has little, oh, okay, yes. The lesser pelvis, the true one, located inferiorly. Located inferiorly. The connection between the greater pelvis and the lesser pelvis in this region is this ridge called pelvic inlet. So if I go in, now I'm in lesser pelvis. If I go out here, now I'm in greater. And this is the door, pelvic inlet. Okay? Okay? Deal? A very, very, very nice point for Siriski is that he loves to know that you know the borders of the pelvic inlet and the pelvic outlet. Okay, we know greater, and so here, greater, lesser, between the bones. I'm talking between the bones. Greater, lesser. Pelvic inlet, and then when I look bottom, look, pelvic outlet is just here, the circle that exists in this region. pelvic inlet in this region, pelvic outlet in this region, and I will show you what I mean. I show you what I mean. Open. 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 Pelvic. What is this? Pelvic. Yes, that's the pelvic outlet. Inlet. Pelvic outlet. Share a different one. I hope you now get to see it. Okay, this one here, this line. See? Above this line in this region is the greater pelvis. Below this line is the region lesser pelvis inside. Now we need to know pelvic inlet, which is this border, and pelvic outlet, the border on the bottom. And I don't know if you know what I'm talking about, but here, this region is pelvic outlet. This region is pelvic inlet. And I need you to focus with me because you need to know the borders. Deal? The pelvic inlet marks the boundaries between greater pelvis and lesser pelvis. Marks the boundaries between greater pelvis and lesser pelvis. The borders of the pelvic inlet, posterior, lateral, anterior. Borders of the pelvic inlet, posterior, lateral, anterior. Posterior is the sacral promontory. Sacral promontory. And sacral wings. Posterior, sacral wing, promontory, sacral wing. Okay? Sacral wing, promontory, sacral wing. Okay? Lateral. Lateral. Arcuate line on the inner surface of ilium. Arcuate line of the inner surface of ilium and pectineal line on the superior pubis ramus. Again, I'm sorry, I'm confusing you, I know. Surfaces. Arcuate line of ilium and pectineal line on ramus of pubis. So you see, all of this continues and makes the inlet. The last thing we have to talk about is the anterior border of the pelvic inlet. The anterior border of the pelvic inlet. Anterior border of the pelvic inlet. Here, we said sacral wing, promontory, sacral wing, promontory, sacral wing, arcuate line of inner ilium, pectineal line of ramus of pubis, and pubic symphysis, anterior pubic symphysis. These are the borders of the pelvic inlet.
Sorry, but anterior border, what
Pubic
is?
symphysis. Pubic symphysis. Pubic symphysis. The pelvic outlet, on the other hand, posteriorly we have, oh fuck, I didn't select the, just give me a second. Coccyx. Posteriorly we have tip of coccyx, tip of coccyx, laterally ischial tuberosities here, laterally ischial tuberosities.
What was the posterior one?
Posterior is tip of coccyx. Tip of coccyx.
The tip?
Yes, the tip here, this tip.
Okay.
Ischial tuberosity laterally and anteriorly we have the pubic arc. The pubic arc, the inferior border here, pubic arc, this one. If you, how do I say it? If you draw a circle from here to here, to here to here, anteriorly it's this part and it's called pubic arc. Pubic arc, which is the inferior border of the issue pubic rami. These are rami of pubis and ischium. So issue pubic rami, ischial tuberosity, tip of coccyx, ischial tuberosity. This is the circle of the pelvic outlet. Okay, of the pelvic outlet. Deal?
You mentioned ramuses, so it's anteriorly pubic arch plus ramuses, or it's just a connection of the ramuses?
Okay, let me show you what
Pubic
I mean. Let me show you what I mean. You have ischium, right? If you click parts, boom. It's the inferior issue pubic ramus. Because this is the connection between ischium and pubis. So issue pubic ramus, and we're talking about the edge of it. So it's called the pubic arc. The pubic arc is made up of the issue pubic rami, the right and left, and then you are talking about the ischial tuberosities on right side, right and left, and finally the tip of coccyx. Deal?
Okay, yeah.
Yeah. Yeah. Now, that's the pelvic girth. You can go deeper and talk about the parts of the hip bone. Like the hip bone is made up of ilium, pubis, ischium, and one more thing you can mention. Height? No, no, 1 second. Height. Here, that. Okay, let me get it out, sorry. I hide others there. Parts. You can talk about what? The acetabulum. Here. The acetabular fossa or the acetabulum. It's a very important part because, okay, it's not shown here in this, but this is ilium, this is ischium, this is pubis, and the surface of the acetabulum is made up of the 3 bones joining. Here ilium, here ischium, and here pubis. This is one more point you can add. This is the pelvic girth. Deal? Any questions?
By the way, when we will, if we describe the hip joint, and we need to mention that hip joint consists of acetabulum and head of humerus. So do we need to say that acetabulum consists of
Head of?
So we should
head
say
of?
head of femur.
Yes. Continue.
Okay. Yeah, and the acetabulum, it's more like it's right to say that acetabulum consists of parts of the pelvic bones, right?
Yes, you can say that the articular surface of the acetabulum is made up of, or you can say the articular fossa of the acetabulum is made up of the ilium, ischium, and pubis. And I will show you. I will show
But
you what I
isn't
mean.
it a little bit risky to go into much detail, Basilinsky?
Yes, guys, we've discussed so much about the pelvic gird, and don't at the end you don't need to talk about acetabulum, but just mention it because acetabulum is a fossa that is involved in the hip joint, but don't mention what it's made up of. It's fine. Okay, when you're done, mention the acetabulum is the articular fossa or the socket which the head of femur fits in to form the hip joint. That's it.
Mhm.
Okay. And we're done for today. Like these are the 5. I hope you guys are feeling better.
Yeah.
Okay.
And yeah, I have.
Okay. The second sternocostal joint have thin capsules reinforced by sternocostal ligaments. This is something about the second one. So the first one we know, fibrocostal cartilage. Second one, it's reinforced by surrounding sternocostal ligaments. Surrounding sternocostal ligaments, okay? We know all of them. All the first 7 are connected to the sternum. Okay, connected to the sternum. All of the superior 7 joints are sternocostal joints, and they're all synovial, except for the first one here from rib 1 and manubrium. And the first one is filled or has fibrocartilaginous connection between manubrium and first rib. Okay, that's a unique thing about this first joint. Second one, the second sternocostal joint have thin capsules reinforced by surrounding sternocostal joint. Here, thin capsule reinforced by surrounding sternocostal ligaments. Okay. Now, for 8, 9, 10, for 8 here, 8, 9, 10, they are not connected to the sternum directly, so they do not have a direct sternocostal joint. They have something called interchondral joints. Interchondral joints are these joints here. Interchondral. Interchondral joints, they help 8 connect to 7th costal cartilage. 9 costal cartilage connect to 8th costal cartilage. 10th costal cartilage connect to 9th costal cartilage. So it's always interchondral joint connect the ribs to the superior rib above them by costal cartilages. That's the second type of joint. Until now, we have sternocostal, interchondral. Okay. 11 and 12. 11 and 12 do not have joints anteriorly. Here. 11, 12, they are floating, so they don't have anterior joints. Okay? So now, anteriorly, we are done. There is one more thing you have to know here. Costochondral joints. Costochondral joints between the rib and the costal cartilages. Between the rib and the costal cartilages. These are called costochondral joints. So anteriorly, you know all of them now. Sternocostal, costochondral, interchondral. This one is fibrocartilaginous. This one is reinforced by sternocostal ligaments because it has a thin capsule. 11 and 12 do not have anterior joints. Okay. Next. Posteriorly, what happens posteriorly? Posteriorly, all the ribs articulate with the vertebral column. Posteriorly, all the ribs from pair 1 to pair 12, they articulate posteriorly with the vertebral column.
I'm sorry, I forgot what is name of the end of the rib that connects to vertebral body. How it named?
Here, you mean this one?
Yeah,
Okay,
and
so
not
here,
tubercle exactly, where is inferior and superior articular surfaces.
just head.
Just
Head of rib. Head of rib, yes.
Okay, thank you.
Okay. So now, one second. Okay, so yes, now in the posterior side, there's a very unique thing that we have to know. I'm just going to make multiple selections so that you guys understand what I'm referring to. I'm going to select this, and I'm going to isolate it. Okay, so look, this is posterior. Okay, we have two joints here, two joints. Costo-vertebral, costo-vertebral, between head of rib and body of vertebrae, and you have costo-transverse, costo-vertebral, costo-transverse. Okay. Now, to explain costo-vertebral, we have to understand something. Look, if I select this and I hide everything else, and I say, give me the parts. Look, here you have the head. This is part of the costovertebral joint. It has two surfaces here. Superior articular surface, superior articular surface, inferior articular surface. Now, we have to know the specifics of the costovertebral joint. The specific of the costovertebral joint is that the inferior articular surface of the head of rib articulates with the superior facet of the superior facet of the same number of rib. I'll explain what this means. If I go and select this, give me a second, reset. If I go and select, and I'll show you what I mean, and I say hide others, look, now we zoom in at the part. We said that the head of rib is made up of inferior articular surface and superior articular surface. The inferior articular surface, of the head of rib articulates with the superior articular surface or superior articular facet of the same number of rib of vertebra. Okay, so what this means, look. Now we have here, do you see this? Everybody sees this?
Yes.
You have fourth rib, okay? This one is rib number 4. What number is this thoracic vertebra? T4 as well. So fourth rib articulates with T4. So let's concentrate again to describe. Rib number 4 has a head. Rib number 4 has a head which contains inferior articular surface. The inferior articular surface of the head of fourth rib articulates with the superior articular facet of vertebra number 4. Now you're going to ask me, What does the superior articular surface of the head of rib number 4 articulate with? And I will show you. Let's go reset it. Let's do multiple selections. Let's select this, and this, and then we isolate. Look what happens now. Do you understand? The superior, this is the head of rib 4. This is the head of rib number 4. The superior articular surface of rib number 4 articulates with the inferior facet of vertebra number 3, T3. Do you get it? Do you get
Yes.
the costovertebral joint right now? Costovertebral. Costovertebral, we have the head articulate with the two vertebrae. The head inferior surface articulates with the same number of vertebrae on its superior articular surface, inferior articular surface, touching the superior articular facet of the T4, and superior articular surface of the rib number 4 articulates with the inferior articular facet of the vertebra above T3. This is costovertebral joint. There's one more thing. I put in the vertebral disc inside now. And if I remove it, we know that there is an articular disc in between. The head has a third part called head crest. The head crest of the rib articulates with the intervertebral disc. And this is the specifics of the costovertebral joint. This joint, is it clear? It is a little bit confusing, but now I hope I made it clear. Okay? All good?
Yes.
Okay. Good stuff. Now, the next one after it, we're gonna look at the joints involved posteriorly. There's two of them. This we talked about this one now, and we have this one. Now, the rib is made up of head, neck, tubercle, shaft. Yes, we all know this. Head, neck, tubercle, shaft. The tubercle is part of the joint called costotransverse joint. This is the transverse process of the vertebra. This is the tubercle of the rib. So, costotransverse joint. Now, specifics. The medial, it has two places here. The tubercle is made up of two places, just like the head. The first place is the medial part. The medial part is the articulation part. The medial part of the tubercle is the articular surface with the transverse process. So, costotransverse joint is a joint made up of articular surfaces, the transverse process articular surface, and the medial part of the tubercle of the rib. Okay, that's the joint. The last thing I want to talk about, the other part of the tubercle, which is more laterally, the lateral part of the tubercle, and it is involved in the attachment of this ligament right here. This is the superior costotransverse ligament. Just don't worry about superior because there is an inferior, but just remember that the lateral part of the tubercle is the site of attachment of a ligament. It's called the costotransverse ligament. Costotransverse ligament. But just note that now we are not talking about the same transverse process that the costotransverse joint is involved in. No. Lateral part of tubercle reaches out to shake hands with the transverse process on the superior vertebrae. And that is the costotransverse joint. Done. I hope this is easy. I hope this is easy.
What type of joint is it?
That's a very good one. I think it's a plain joint, but I'm not sure. I'm not sure. Let me see. Let me see. I will check for you. Costotransverse joint type. That's a very good question. Yes, plain type of joint. Good. That's a plain type of
And
joint.
the movement
Movement,
is
gliding.
gliding movement. Okay.
Yes, plain joints are gliding joints. And these plain joints, such as the joints also between carpal bones, such as lunate, scaphoid, tricutrum. These joints between these bones are plain and they are gliding. Okay. Okay. Now, I know this point took a lot from us, but it's good to understand. And then, just give me a second. We talked about costotransverse. We talked about costovertebral. Okay, I think we're done for this point. These are the joints of the thorax. This is done.
So we have 5 of them, right? Costovertebral, costotransverse, costochondral, interchondral, and sternocostal.
Exactly. Exactly.
Okay.
1 second. Okay. Okay. Easy. These are the joints. So this point is done. Deal?
Yes.
Okay. Next one. All clear?
Yeah.
Okay. Good.
Hmm?
That's good. That's good. That's good. That's good.
Oh, I have a question.
Yes, please.
So plain joints are like the movements of plain joints only the gliding, right?
Gliding. Exactly. Gliding.
Okay.
Okay. Next joint is, let's say, knee joint. Knee joint, I can finish it really quickly. Concentrate with it. Knee joint. Now, the knee joint, bones involved. Again, we have a scheme. Bones involved. Femur, tibia, patella. Femur, tibia, patella. Now, before I move on and talk about articular surfaces, fibula is not part of the knee joint, remember. Okay? Fibula is not part of knee joint. Now, bones, femur, tibia, patella. Articular surfaces. Articular surfaces. A question for all of you. Is the patella in any way able to articulate with the tibia?
No.
Good. This is a point where I was shouted at from Sirisky. I went into my exam and I told him that the patella articulates with the tibia. We see here that the patella does not articulate with the tibia. Okay? Now, what are the articular surfaces in the knee joint? And concentrate with me. Now, we know that the femur distal part is made up of 3 articular surfaces. The lateral condyle, the medial condyle, and the intercondylar fossa. That's the articular surfaces of the femur, talking about the articulation with the tibia only. Plus, there is an articular surface of the femur with the patella. The patellar surface of the femur found distal anteriorly articulates with the articular surface of the patella found posteriorly. Do you agree?
Yes.
Patellar surface of the femur articulates with the posterior articular surface of the patella. That's the first articular surface. The second articular surface that we said condyles medial and lateral with the intercondylar fossa articulate with the tibia. How? On the lateral and medial condyles of the tibia plus the intercondylar eminence. This one is an eminence. It articulates with the intercondylar fossa. And these are the articular surfaces of the knee joint. Clear?
Can you repeat like the
Yes.
after patella?
Okay, patella posterior articular surface articulate with the patellar surface of the femur. Then we are talking about these here touchings. We're talking that, and I will maybe use this. 1 second, 1 second. Just give me a second. I'm gonna reset, I'm gonna select, I'm gonna isolate, boom. The lateral condyle and the medial condyle and the intercondylar fossa of the femur. They articulate with the tibia on. They articulate with the tibia on the lateral articular surface of the tibial condyle and the medial articular surface of the tibial condyle and parts the I hope they can give it to me, intercondylar, here, sorry. Okay, you get it. But this part is called the eminence, intercondylar eminence. The intercondylar eminence says hi to the intercondylar fossa of the femur. These are the articular surfaces. Deal? Okay. All right. Now, what type of joint is this? Easy. Hinge. What movements? Flexion, extension. Easy. Finally, we have the ligaments. And the ligaments are 7. This is the hardest part of this joint. 7. First, we have the patellar tendon. The patellar tendon. We have, I hope I know them, I can refer to them. Fibular collateral ligament. Number 3. Tibial collateral ligament. Again, patellar, fibular collateral, tibial collateral. And you have posteriorly, we said anterior, lateral, medial. Now posterior, we have oblique, popliteal, and arcuate popliteal. And these are 5. We have 2 more. I can't see them. They are inside the ACL and PCL, posterior arcuate cruciate ligament, anterior cruciate ligament. 7. Deal? Again, patellar tendon, lateral collateral, tibial collateral, fibular collateral, oblique popliteal, arcuate popliteal, anterior cruciate, posterior cruciate. Done. We're done with the knee joint. Easy?
Yeah, and do we need to mention the meniscus?
Yes. Yes. You need to also mention the menisci. The menisci, they lie here. Menisci are cushioning tissues. Menisci are cushioning tissues. They take the force when the femur is pressing against the tibia. Okay? Remember. And
Did
we're
you
done.
mention the transverse ligament?
Transverse ligament. I don't know where it is actually. But the ones I mentioned are very, very
The
enough.
transverse
But,
ligament.
go ahead.
Okay.
Yes, I know what you're saying. It's here. Yes, somewhere here.
Yes, it's like
Yes.
between the medial and lateral
Yes,
meniscus.
I remember now. So now we have 9. Remember, transverse, menisci, anterior cruciate, posterior cruciate, tibial collateral, femoral, fibular collateral, oblique popliteal, arcuate popliteal, and fucking patella. Deal?
Mm-hmm.
We know them?
I'm sorry. Yeah, maybe I was missed, but in the beginning you said that fibula isn't a part of knee joint. Yes.
Fibula, yes, look, it's not. It's just articulating with the tibia.
Mm-hmm. Okay.
That's it. These are the parts. And never tell me patella articulates with tibia, okay?
Yeah, of course.
Okay. Good, good. All right. Knee joint done, easy. Done, easy.
Yes.
Yeah.
Okay, next. Now we have, let's talk about the fucking pelvic gird. And this one might be long. Okay, you know what? Maybe orbit. Let's see the orbit, because the orbit is very, yeah, orbit is shorter. Let's talk about orbit very quickly. The orbit, this is the orbit. What's at the house of the eye? We need to know all the borders: superior, lateral, medial, inferior, inside, everything. Okay, so be ready with me. Orbital cavity. First, they enclose the eyeball and its associated structure. The orbit enclose the eyeball and its associated structures. That's the first point. And in this part, we're going to discuss borders, contents, pathways. Borders, contents, pathways. Deal? Let's move on. The borders, we have roof, we have floor, we have medial wall, lateral wall, apex, base. Again, roof, floor, medial wall, lateral wall, apex, located near the opening of the optic canal. Just give me a second. Somewhere here, yes, there, apex, and base. This opening on the face is the base. So base, apex, superior, inferior, medial, lateral. These are the borders. These are the borders. Deal?
Mm-hmm.
Okay. Superior, or the roof, formed by the frontal bone and the lesser wings of sphenoid. Frontal bone and lesser wings. Lesser wings of sphenoid, which is this one. This is the greater wing. So, roof, lesser wings, and frontal, because look, we go in here, and what's on top of us when we go in this region is the lesser wings of the sphenoid.
By the way, do we need to mention like the roof consists of orbital surface of frontal bone, or we can just say frontal bone?
Just say frontal bone. You can say whatever you want, but orbital surface of frontal bone is good. However, just if you say frontal bone and the lesser wings of sphenoid, easy. That's done. Now, floor formed by maxilla. Here, maxilla, zygomatic bone, and fucking palatine. Where is it? Where was the palatine? Wait, how is it? The palatine inferior, yes, the maxilla aspirates. Where is the palatine? Can I just this is the ethmoid. Where is the palatine here? Maxilla. Just give me a second. Give me a second. I'm confused. Why am I confused? Somehow, wait. Maybe I'm not catching it. One second, one second. Maxilla 7.1. Wait, does why do I have it in my head with the palatine? Does the palatine or the lower of pelvic? Yes, it does. Yeah, why? But I don't see it. Palatine. Maybe some parts of it. Yeah, tell me.
Which plate of palatine bone is there?
Wait, let's see. Hide. Wait. Let's check it this way. And if I check, boom. Ah, there. Here. Palatine. Hide. So here, see this shitty part right there. Do you see what I mean? Right there.
Yeah.
So floor, if you go boom, why are they saying floor? Because we might be here, close to the apex. So if imagine I'm walking from here to there, that's why I can reach the palatine on my floor under my feet. Do you understand?
Mm-hmm.
Yes. Damn, that was fucked. That was fucked. Look, palatine is right there. Here. Okay. There. All right,
Mhm.
palatine. So
And it's
maxilla.
the
Yeah, go ahead. It is, yes.
perpendicular plate.
Yes, let me give it to you. I'll be very yes, here. Why is the teeth in there? But okay. Parts. Boom. Orbital process. There we go. Deal?
Mm-hmm.
Okay. So the orbital process of the fucking palatine. Easy. Now we know the roof, and the roof is made up of lesser wings of sphenoid. Frontal floor is made up of maxilla, zygomatic, orbital process of palatine all the way in, right there. Okay?
Mm-hmm.
Now the next thing, medial wall formed by ethmoidal, maxilla, lacrimal, sphenoid. Medial wall, maxilla, of course, maxilla. Look, if we look at the medial wall, maxilla is part of it. Lacrimal, ethmoidal, and for some reason, the sphenoid, because it's right there. Okay, medial wall.
And
Sphenoid,
which wing of?
that's a very good question. It's not a wing, it's the body.
Mm.
Okay, so here, this is lesser, greater body. So sphenoid, ethmoidal, lacrimal, and maxilla. Medial wall, done. Lateral wall, zygomatic bone and greater wing of sphenoid. Zygomatic and greater wing of sphenoid. Okay? Lateral. Zygomatic and greater wing of sphenoid. Again. And at the latest we have apex base. Apex, look, that's the apex. Boom. Optic canal. Base, that's the base. Imagine we have a cone. The base of the cone and the tip of the cone. Optic canal, base. Boom. Again. Superior, frontal bone, and lesser wings of sphenoid. Floor, zygomatic and maxilla with the orbital process of the palatine. Then medial, you have ethmoidal, lacrimal, maxilla, and body of sphenoid. lateral, zygomatic, and greater wing of fucking sphenoid, and then apex, optical canal, base is the outer edge, and the base opens into the face and is also known as the orbital rim. Orbital rim. Okay. Orbital rim. Contents. Next one is contents. The bony orbit contains eyeballs and their associated structures. 4. We have eyelids that cover the orbits anteriorly, nerves, blood vessels, extraocular muscles. Again, it has the eyeballs and the associated structures. Extraocular muscles, eyelids, nerves, blood vessels. Pathways is the last part of the orbit, and we're done. And they have 3: optic canal, superior orbital fissure, inferior orbital fissure. We're done. Optic canal, superior orbital fissure, inferior orbital fissure are the pathways into the orbit. Any questions about the orbit? We are done with 3 points. Here, superior orbital fissure, inferior orbital fissure, optic canal, openings, the contents, eyeball, extraocular muscles, nerves, and one more,